In this next video you're going to watch today, you're going to see a fox. This was a fox that was caught in a fence, and it was caught by its left hind leg, and when it was brought into the wildlife hospital it could be seen on x-ray that the hip was dislocated. Now the vet himself wasn't able to attend, and the vet's nurse and the manager inquired as to whether A, I could relocate a hip, and B, would I be prepared to. Now I have relocated joints in both people and animals, and I was fortunate that I was taught a really good technique by a paramedic friend of mine, who said with dislocations it's really important that you warm up the soft tissues around that joint prior to attempting any form of manipulation. And so that's exactly what we did. It takes me about 30 minutes to get to the hospital, so I got them to prep the fox. Obviously it needed to be anaesthetised, and then they used a mixture of hot water bottles and that to warm up all of the soft tissues around the hip itself. And the clip you're going to see first of all is of the actual relocation job being done. It is all very gentle, and as you will see it's also successful. And then you'll see what else I had to do for us to sort of get this fox back able to walk again. So here we have the first x-ray, and it shows the hip dislocated, and now I'm just removing the heated makeshift water bottles and just feeling for the orientation of the joint. Because x-rays are two-dimensional, it was essential that I knew exactly where all the structures were in relation to each other. And whilst I'm doing this, you can see I'm still using another water-filled glove to keep the muscles warm. The warmer the muscles are, the less traumatic the relocation will be. And now I'm using some traction, whilst with my thumb and fingers I'm actually encouraging the joint to the hip to just gently go back into the socket, so that the thigh bone or femur to actually relocate into the socket. And because the muscles were so swollen, it's easier said than done. And fox skeletons are not dissimilar to cats in that they're much finer than your average domestic dog. And the process involved lots of very careful and very focused articulation, and then I'm gently feeling the quality of the joints. And here I am now with the fox on its back, and that's me actually moving the legs. You can see the nurse has got the anaesthetic cone still over the fox, and now I just want to feel if those joints are seating correctly. This is the affected one, and the other one perfectly okay, but it means I've got one to use as a gauge as to how we've done. And it's essential to ensure that we've got everything as good as we possibly can, because we want to keep this fox under general anaesthetic for the shortest space of time that we need to. And here I am just making sure I've got the angle right, and then just ensuring I've got the seating of the joint perfectly okay. And these are gentle manoeuvres, but they're very, very focused and should only be done by somebody who knows what they're doing. And then just a final check to feel for the quality of the movement of both the hips and the legs. And then on this x-ray you can see that the hip is back into the socket, but there's a lot of distortion to the pelvis. And so now the next stage was to actually try and get the muscles that are holding, and all the fascia and soft tissues, ligaments, etc., that are holding each half of the pelvis where it joins with the spine. My next job was to actually get all of those to sort of be at an even resting state. So when you hear things about, oh, the pelvis was out, so I popped it back in. There's no popping a pelvis back in. That hip was luxated, and that was the only popping back in that was going to be done. And here I am, I'm still trying to keep everything nice and warm, and I'm feeling for the orientation of all the soft tissues here, and then just gently articulating and manipulating until we've got all of these joints functioning as they should. And that little jolting action all the way through knocked the anaesthetic tube off, which was quickly then replaced. And here I am just retesting to see if I've got the pelvis articulating with the lumbar spine, and then feeling for the quality here of all the what we call the ventral muscles, because this fox is obviously on its back. We want to know that all the ventral structures are feeling as even as they can be. All the time I'm trying to keep the joint that was luxated nice and warm, so that the soft tissues can just get back to normal function, and we can get a decent blood flow back through those muscles, because it's a fairly well known fact in the medical field that muscles around dislocations go very tight, and that restricts the blood flow through them, and so they actually get quite cold, as opposed to when you've got a fracture, everything feels a lot hotter. And also with a sprain, usually a sprain is hotter. So here I am just using various techniques to just get the ligaments to effectively recoil and pull the pelvis back into, for want of a better phrase, a better symmetrical shape, so that all the other surrounding structures can perform as they should. And this is the same whether it's a fox, a dog, a cat, a human, or a horse. You want to try and normalize the functioning of all of the soft tissues. And here I am, I'm just checking the various landmarks that we find, and then if we look at this x-ray, you can see that's a lot more symmetrical. Now, we left this fox with cage rest for about 4 or 5 days, and then because it was quite docile, the vet, who you can see with gloved hands there, gently caught it, and then he's restraining it, so we don't want to put it through another general anaesthetic unless we have to. And then I'm just going to quietly feel for the symmetry of all the structures and the quality of all of the structures. And what I should note with the hip, once that was relocated, there was none of the crepitus and horrible feeling that you get with we call it a luxated joint with animals, and if it's a human we call it a dislocation. So it's a luxation or a dislocation. And what I'm doing here is just feeling for the quality of all the muscles and soft tissues around the spinal joints, and then where the spine meets the pelvis at the sacroiliac joints, and just really sensing through what the fox can feel, because although they're very good at hiding their emotions, their soft tissues do give off little indicators. And I apologise that the camera work was all done by amateurs. We basically had to just hand the camera to whoever was available, and they were doing the best job they can. And you can just see there's a little bit of lateral rotation to that left hip there, but that could also be just the way the fox is restrained, that it's actually leaning back slightly. And now I'm getting the nurse to feel it, because she was the one that did all the x-rays with the vet and did all the initial hard work. And here I'm just wanting to feel the temperature in the foot, but also the little deep tissue reflexes that you get between the toes, just for a response. And it was even both left and right, and then I'm just getting the nurse to check them as well. Because the more that we share what we do and each of us can understand how the other's working, then the better the outcome can be for these patients. And I should note, this is a wild fox. It is not a domesticated one. It's not one that's been kept as a pet. This was a genuine casualty, and as such, the aim was to release it back into the wild, and in order to do that we need it to be fit and healthy. And here I am just encouraging, there's just a little bit of imbalance or asymmetry in the resting state of some of these muscles, so I was just doing a little bit of work there, very simple work to just reset the muscle spindle. So effectively it's a little bit like rebooting your computer, just altering the resting state of some of these tissues, before then allowing the fox to try and continue its recovery. And what I'm doing here, I'm not actually tickling and stroking the fox as such. I'm checking for a particular reflex that you get, which if interrupted can tell you that there's nerve damage, and this fox, there was no signs of any of that, so I was happy with the outcome with this. And then we're just discussing what needs to be done, and then just a simple case of then returning the fox to a quiet cage, and letting it continue to recover. Once we were happy with everything we could do, then it was a case of gently getting it back into a cage, and I'm ensuring the hips are okay, before then transferring it back into a proper sort of kennel cage to further recover. And so you can see that osteopathy can be used for some amazing things. Now obviously this is all done within a hospital environment. This is not the sort of thing that we can standardly do in our normal clinics, but it does show the scope of what osteopathy can do. Now this fox, as you could see, we re-examined him, he was doing really well. Unfortunately, 5 days later he passed away. He had what we think was a blood clot, and we think that got to the brain because the staff commented that he'd been quite quiet, and then during the evening, this particular evening, he then had what amounted to a small fit and passed away very quickly before anybody could do anything. But we wanted to show you this film to actually show what is possible to do, and also some of the cases that the hospital has to deal with, because it's not just a case of taking something cute and fluffy, feed it for a few days and then release it. They're dealing with cutting edge stuff similar to any A&E department within the NHS, and as an osteopath I quite often get to see some of these cases, and so we wanted to share this with you. It's not something I do on a day-to-day basis, but it is something I do more often than probably a lot of my other colleagues. Yes, so that's our story of the fox, this particular fox, and hopefully we'll be able to bring you better news with some of our other cases. Until then, stay safe and stay healthy.